Guided mindfulness exercise for health care providers. Understanding the suffering of a cancer patient. Begin by finding a comfortable, quiet place to sit. Close your eyes if you feel comfortable doing so, and take a deep breath in. Slowly exhale. Allow yourself to settle into the present moment, letting go of any distractions or thoughts about what lies ahead in your day. Let the rhythm of your breath guide you into a space of calm presence. Now, imagine that you are standing in the hospital room of a cancer patient, someone who is suffering immensely. This patient is in physical pain, emotional distress, and fear. They are no longer the person they used to be. They are fragile, exhausted, and struggling to hold on to the life they once knew. See this patient in your mind's eye, not just as a case or a diagnosis, but as a human being with hopes, fears, and a deep need for compassion. Take a moment to feel the weight of this patient's experience. Feel their exhaustion, the constant ache in their body, the deep sense of loss. Imagine that they have been fighting cancer for months, enduring painful treatments, and yet their body continues to betray them. They are scared, lost in the overwhelming fog of their illness, and yet they are still clinging to the hope that someone, you, will see them, truly see them, not just the disease, but the person within. Now, consider how this patient is feeling. They are in a hospital bed, connected to machines, barely able to move. They are weak, their energy drained, and their body is no longer the one they remember. They look in the mirror and see someone who is fading, someone who is struggling to hold on to their sense of self. In this moment, they do not need just another round of medication. They need your presence. They need kindness. They need you to take a moment to see them, to look them in the eyes, and understand that beneath their physical pain, there is a human soul. A soul that fears what lies ahead, but is still desperate to feel respected, loved, and seen. Take a deep breath and recognize the weight of this need. Let it guide your awareness. As you move forward in your role, think of those early moments when the patient first receives their diagnosis. They are terrified, filled with questions they can barely articulate. You, as the doctor or nurse, have the power to help them feel heard. It is not just your medical knowledge they seek. They need your compassion, your humanity. Imagine sitting with this patient, patiently listening, allowing them to ask their questions, even the ones they cannot yet fully express. Speak gently, acknowledging their fear, and offer them the assurance that you will be with them every step of the way. Now, visualize the patient enduring their first treatments. The chemotherapy, the needles, the pain. They are so weak, so small, and the treatment that is meant to save them also makes them feel like they are losing themselves. The patient needs tenderness from you, not just physical care, but emotional care as well. Imagine yourself gently inserting an IV, speaking softly, and holding their hand if they need it. Your touch can be a lifeline. Your kindness can offer them a sense of safety in an otherwise unsafe world. Let your actions speak louder than words. Consider the patient on the days when the pain becomes unbearable. It is not just the physical pain, but the emotional anguish of watching their body deteriorate, of feeling like they are losing control over themselves. They are afraid, desperate for comfort, not just in the form of pain medication, but in the form of human kindness. In these moments, the patient needs you to see them, not as a chart or a diagnosis, but as someone who is hurting, someone who has loved and lived, and is now fighting to hold on. In these moments, imagine yourself sitting beside them, offering a soft word, acknowledging their pain with compassion, letting them know that it is okay to feel vulnerable, to feel lost. Hold their hand, if they will let you, and simply be there. Your presence can offer them the peace they need to face the suffering they cannot avoid. Now, imagine the patient's condition worsening. Their body growing weaker with each passing day. The end is near, and they are afraid, not just of death, but of leaving behind the people they love. They need you to approach them with dignity. As their body fails, you must never forget that their soul still needs care, still needs to be recognized. Speak to them as a person, not as someone who is fading into the background. Acknowledge their life, their story. Ask them about their hopes, their family, their regrets, not just their medical history. As you approach the final days, consider how the patient's family is also suffering. This patient, who once was a mother, a partner, a friend, is now facing the inevitable. They need your help too. The family needs to know how to say goodbye. They need you to support them with the same compassion you show the patient. Your role is not just to treat the body, but to care for the spirit of the entire family. Finally, imagine the patient in their last moments, when they can no longer speak, no longer move, no longer hold on. The physical pain may subside, but the emotional weight lingers. It is in these moments that your kindness, your compassion can be the most powerful. Let them feel that they are not alone, that their life mattered, that they were loved until the very end. Take a deep breath and remember that the patient you treat is not just a body. They are a person. Their illness is only one part of who they are. They have lived, they have loved, and they are facing the most difficult moment of their life. And in that moment, they need you to be fully present, to treat them with the same respect, compassion, and tenderness you would offer a loved one. In doing so, You will not just help them through their final days, but you will offer them a kind of peace, a sense of dignity, and a sense that they are more than just their illness. Take one last deep breath. When you're ready, gently bring your awareness back to the present moment, carrying with you the understanding that you have the power to make a profound difference in the lives of your patients. Not just through your medical knowledge, but through your presence, your kindness, and your compassion.